Okay, so can you tell us your name for those of us who don't remember?
Yes, my name is Arlene Spilker.
Okay, and what type of nurse are you?
I am a neonatal intensive care unit nurse.
Okay, and do you feel like you empathize with your patients or the parents of your patients?
Absolutely.
Okay, and can you share any personal examples or experiences in kind of empathizing with your patients?
Definitely. So when you're dealing with infants, they can't talk to you, so they are not able to tell you, I'm in pain, I'm tired, I'm hungry, and any of those kinds of things. So your powers of observation get really acute, and you are able to see based on changes in vital signs, changes in facial expression, changes in the way they move their extremities, that they're in pain or uncomfortable or even ready for interaction and those kinds of things. And I have actually gotten more empathy for patients since I've started doing teaching. And I think part of that is when you're in it all the time with patients, it's really hard to keep that level of empathy up all the time. It really is, because if you are that empathetic, you take on these people's pain, really. And when you are working in that environment 4 or 5 days a week, that's a lot of pain to take on. And so I think a lot of nurses will step back from that. And I think that's perfectly acceptable and appropriate, as long as you are still able to experience empathy and show the patient empathy. It doesn't necessarily mean that you have to take on all of the negative feelings that are associated with that. So now when I go to work and I see the babies and I know they're in pain, I have a lot more empathy for them, because I recognize it's like every time it's fresh for me, whereas the nurses who are there all the time see it. And this was regardless of the fact that, yeah, they get immune to it, and regardless of the fact these are babies. I mean, you'd think everybody would just be like, oh, but when you have to cause pain to your patients, you have to do something with that empathy. If we were so empathetic that we're like, oh, I don't want to hurt them, we couldn't do our job. So it's a very fine line, yeah.
Awesome. So do you think that this kind of affects your personal life, just taking home that empathy?
For sure.
Absolutely. And can you expand on that, like in what way that affects your personal life?
Yes. So nurses deal with stuff that nobody else really has to deal with, unless you're maybe a cop or a firefighter or a surgeon or something like that. You're dealing with literally life and death every day. And so a couple of things happen to nurses over time, depending on where they work. Sometimes they'll get what we call this gallows humor, where everything is humorous to them, even things that other people would be appalled at. And that's because we have seen it all, and when we are in the moment, sometimes people will say things that are funny in order to break that tension, and that's the only way we get through that shift, is because, and we know it's inappropriate, we know, but you would rather have that nurse be inappropriate for a second, and you're unconscious. This isn't going to be something we do in front of patients. And you have to have that ability to laugh about it and move on, or deal with it in some way. Some people do it differently, where they will go home and they will journal about it, or they'll go home and they'll exercise, or they'll go home and they'll drink, okay? Or they'll go out with their girlfriends that are also the nurses, and they'll vent to each other about it. Some people will shop or do drugs to get that problem away. And this is a rampant problem for nursing. This is a huge problem. And we need to, part of it is that we don't have enough empathy for ourselves to stick up for ourselves. And so we are constantly just giving, and then there's nothing left for us to give. So that's how nurses get burnt out later on, because they've given all they can, and they're not getting, you have to fill your own bucket before you can give somebody else water, that kind of thing.
All right, well, that kind of factors into the last question, which was any advice for future nurses on coping strategies?
Yes, number one coping strategy is to be proactive and stick up for yourself, all right? This is a very hierarchical organization structure that you're going into, this healthcare thing. There's executives, there's insurance, there's regulating bodies, there's doctors, there's administrators, there's all that, and you are the person that's at the bottom of that chain, not literally, but you're the point between the patient and that. So all of those decisions that those people have made are impacting your day every single day. So vote for more nurses. If you belong to a union hospital, vote in your contract. Let people know, I'm not getting a break. I have not sat down for 8 hours and I have not peed. I need a break now. And the manager should be able to accomplish that for you. She can stop doing her paperwork for 5 or 10 minutes and give you a break. If she's a decent manager, she will. We need to support each other and stop being this nurses eat their young stuff. We need to stop that. That's ridiculous. So be assertive, take care of yourself, positive coping mechanisms, hang out with your girlfriends, talk about it, debrief about shifts that are really just horrible and awful. Over a glass of iced tea, or lemonade, low-cal, or water, or something like that, but not always cocktails, okay? Not always cocktails. And really start doing all those yoga, meditation, all of those things really, really work, really work. Talk to counselors. Why nurses aren't required to go to counseling every once in a while, I don't know. We're just supposed to take on all of this stuff and then figure it out. Like we're just really that evolved, and we're just not. And we need to stop emotions. We're not, and we have to take care of ourselves. So that'd be my number one thing, take care of yourself.